Welcome to your quick guide on nervous system medical terminology. Whether you're studying pharmacology, neurology, or working in patient care, this guide will help you master essential terms related to the nervous system. Let's start with the basics. Neuro means nerve. For example, neurology is the study of the nervous system. Pathy means disease. So neuropathy refers to a disease or dysfunction of the nerves. Algia means pain. Neuralgia is the term for nerve pain. CNS stands for the central nervous system, that includes the brain and spinal cord. PNS refers to the peripheral nervous system, all the nerves outside the brain and spinal cord. Now let's talk about terms related to the brain and spinal cord. Encephal, O, means brain. So encephalitis means inflammation of the brain. Mening, O, refers to the meninges, the protective layers around the brain and spinal cord. Meningitis is inflammation of these membranes. Myel, O, refers to the spinal cord, and sometimes the bone marrow. Myelopathy is a disease of the spinal cord. Let's move on to nerve function and some common disorders. A synapse is the small gap between two neurons where messages are passed. Neurotransmitters are chemicals like dopamine, serotonin, and acetylcholine that help send those messages. A seizure is a sudden burst of electrical activity in the brain. Epilepsy is a chronic condition involving recurrent seizures. Multiple sclerosis is a disease where the immune system attacks the protective covering of nerves, affecting the brain and spinal cord. Now, here's how these terms show up in pharmacology. Anxiolytics are medications that reduce anxiety. Anticonvulsants are used to prevent or control seizures. Analgesics are drugs that relieve pain, and some work directly on the nervous system. CNS depressants slow down brain activity and are used in sedation or anesthesia. CNS stimulants increase alertness and are often used to treat conditions like ADHD. And that wraps up your essential guide to nervous system medical terminology. Keep reviewing, and you'll have these terms mastered in no time. Thanks for listening.